Okay, I want to say good morning to everyone who is joining us today for this webinar. We've got quite a lot of people signed up, so I'm just going to wait for everyone else to sign in. For everyone's information, this video is being recorded, so if you need to review this after we finish today, you will be able to do that on our YouTube channel. In addition, we are going live on Facebook and live on YouTube as well. So hopefully there'll be people joining us there who'll be able to ask us questions directly. We've got a few people already signed into Facebook, etc. So we've got a really packed morning today. We've got roughly 100 people signed up. I'm not expecting that many to join us because people have busy schedules. But I'm going to introduce a number of people to you in the first few minutes of today's webinar. I'm welcoming Bothena, who I work with in the UK. My name is Ben from Medical Doorway. Bothena is from St. George's University in Grenada. Bothena is kind of the anchor that keeps everything held together, really. Without her, we wouldn't be going anywhere, really. She is going to be very responsible really for speaking to you guys as individuals when you've got any specific inquiries to do with aspects of applications, enrollment, the university, the scholarship opportunities which are significant at the university. And then really she kind of, if I've got a query that I don't know the answer to, Bothena is my first point of contact, and I always get the answer that I need directly from her. Joining us very shortly, he's on another meeting, but he will be with us in a couple of minutes, is Dr. James Cowie, who's an academic from St. George's University, who's based at Northumbria in the UK. And he is basically responsible for part of the tuition for the students who want to start their program at the campus in the UK. And then we are joined by two graduates and doctors, and let's be honest, they're the important people that we want to hear from today, who are both working in the United Kingdom as doctors who've trained at SGU and have done clinical placements in the UK and the US. Dr. Patel has been actually working in the UK since 2011, so 10 years in to his career. And from what I remember, Dr. Jackson is a relatively new graduate starting off her career in the UK. So we've just got to wait for Dr. Cowie to join us. He will be joining us shortly, but what I'm going to do is I'm just going to let the other members of today's panel introduce themselves as well while we wait for the presentations to start.
Thank you, Ben. Appreciate it. Absolute honor to have a partner such as yourself. Really honored to be partnered up with Medical Doorway. As Ben said, my name is Bothena Hamed. I am the recruitment manager at St. George's University School of Medicine. I will include my contact details in the chat box. Please feel free to ask any question throughout the session, and also please feel free to reach out to me via email or using my Calendly link. We appreciate you taking time today to attend this session. Thank you very much, and I hope you enjoy the session. I believe Dr. Cowie has just joined us, so I will pass this on to Dr. Cowie.
Suspense is killing you. Good morning, afternoon, evening, everybody. I'm just going to share my screen with you. Hopefully we've had some introductions so far. Let's see if this technology works. Okay, so hopefully with the magic of Zoom, you can see my screen. By way of an introduction, my name is James Cowie. That's me on the screen, and that's me in the top left-hand corner. I am a medical doctor, but in this capacity, I'm speaking to you as the UK Dean, the person responsible really for the UK program. We are obviously from St. George's University. You've got two of our alumni on this call as well, great at different stages of their career, and I'll try to do the boring bit and let them explain to you what it's really like. I trained in the UK. I graduated more years ago than I care to remember. And I would start off by welcoming you to what is effectively the most noble of professions. Certainly my time through medicine enabled me to travel the world. I was able to practice medicine in more than 8 different countries before coming back to the UK. So I actually didn't go to St. George's University, but I graduated from the UK, as you may tell from the accent. My capacity for speaking to you about medicine is endless, and I won't take up all the time, so I will get to the point. And at this stage, most of you are thinking about making that decision of going to medical school. So I need to ask you why. Okay, why do you want to be a doctor? I myself have interviewed probably something in the order of 300 or 400 medical students, and it's a very common question to ask that fledgling medical student. Why do you want to be a doctor? It's also a potential pitfall. Okay, it's not the right answer to say, I want to be a doctor because I want to save lives or I want to make a difference. And you'll be scratching your head at this point, but you must not say that in an interview, because if you ask the patient who makes a difference in a hospital, it's often not the doctor that saves the lives. It might be the nurse or even the healthcare assistant that sees that the patient is uncomfortable, needs to be supported. After an operation, we've got a pediatric surgeon on the call, someone who looks after the patient's mouth, which may be dry. Okay, those are the things that make a difference. And if you want to save lives, you probably will save more lives by contributing some of your tuition fees, potential tuition fees, to build a well in Africa or in the developing world. Okay, so just ask yourself why you want to be a doctor. There has to be a more coherent answer to that. It should be something along the lines of combining the science that underpins the practice of medicine with the human aspects of working with somebody. That's a little bit more coherent, but I'm not here to tell you what to write on your personal statements. The story that comes and the answer to that question has to come from you, and it has to be genuine. So the qualities of a good doctor, we could put a word cloud around this, but you can see when you interview patients, it's often the softer skills, the communication skills. We always say that 80% of a diagnosis is based on your ability to listen to your patient. It's not necessarily having a fancy MRI scanner and a full blood panel, okay? It's being able to listen to your patient. And you can see lots of these things are, you would think that knowledge would be important. It is, okay? You do need to be intelligent to be a doctor. But the practice of medicine involves being able to communicate and often be able to work with other people. Okay, those things are important. So from the New England Journal of Medicine, you can see that from a patient's perspective, most of the skills are what I would refer to as soft skills: being empathetic, being a good listener, being compassionate, caring, humble, all those good things, not necessarily being the smartest in the class. So that's definitely worth thinking about and definitely worth integrating into your story to explain why you want to be a doctor. Okay, so that's my preamble. I'm here ready to do the boring bits, as I said already, and to tell you what it would be like for you as a medical student, okay? Now, for the majority of you, okay, I haven't got the right slide here. For the majority of you, you'll be leaving straight from school, right? So that means that you'll be entering a 6 or a 5-year program, right? And over the course of the first 2 or 3 years, you're transitioning from learning some of the basic sciences, remember I said that underpin the practice of medicine, so the anatomy, the physiology, the biochemistry, etc. And you then try to integrate that towards clinical cases. And much has moved on, okay, since I was at medical school. We now have a systems-based integrated course, because what happens is a patient doesn't present to you with a problem with their anatomy, okay? They present to you with a headache, with chest pain, with dyspnea, or in pediatrics, maybe with listlessness and floppiness, okay? So you need to start from a very early age, and this is the beauty of the St. George's curriculum. You need to start from a very early age integrating those basic sciences into clinical scenarios. And that's where the learning occurs. So if you were to take a 5-year program with us, which is typical for most of you, I know we've got potentially students from all around the world here. If you were to look at a 5-year program, so finishing A levels, perhaps 10+2, perhaps, you start off with a relatively science-heavy first year. Okay? Your second year then goes towards learning about things in systems, okay? So you start off with the musculoskeletal system, you go on to the cardiac, pulmonary, and renal system, you go on to look at then digestion and metabolism, okay? And finish off with some neuroscience towards the end, right? And in those lessons, you are sitting around, not in a lecture, folks, it's no longer like school anymore. You sit around with one clinical tutor, okay, and 5 or 6 or more, a few more, maybe 7 or 8 at the most, students. And that clinical tutor is someone who's recently qualified. You're about to meet one of our clinical tutors in Dr. Tatum Jackson, who's not only an SG graduate, but she's also working as a clinical tutor for that first year of the 5-year program. So where do you do these programs? St. George's University is based in Grenada, but we have an outpost, a smaller outpost of St. George's University, Grenada, here in Newcastle, in the sunny northeast of the UK. And everything is taught exactly the same, right? So whether you're here for the 6-year program, the 5-year program, or the 4-year program, you will have the opportunity to do the first of those 3 years in the UK or in Grenada. And to make sure that it's the same, we give the students the same exams at the same time, okay, so we can compare apples with apples. And it is difficult. I'd said that you don't need to be the smartest person in the class to go to medical school, but you need to be able to work hard. Okay? You need to have the aptitude for what will eventually be the practice of medicine. So first 3, 2, or 1 years, if you're a graduate already, you come directly into what you're seeing on the slide here, this 4-year MD program. Okay, so if you've graduated already, if you're watching this and you've got a bachelor's degree, you come directly into that 4-year program. First year in the UK, second year in first 1 or 2 years in the UK. You then have to spend your second year, okay, of the 4-year program in Grenada. Okay, that's because it's a unifying process. And then from there on in, you have to sit your USMLE, which is United States Medical Licensing exams, and hopefully your UK MLA exams, which used to be called PLAB. Okay, so another, I guess, unique selling point of this, and I'm certainly not a salesman, is that this program will enable you to potentially practice in the UK, as my 2 colleagues who are coming on next wish to or are currently, practice in the US, and do clinical rotations in the UK or the US. So you can see where it says MD year 3 and MD year 4, that's when it gets real, okay? You're now no longer sitting around a table with a clinical tutor and some colleagues, you're in hospital. So the first year, the MD year 3, is where you do 7 core clinical rotations across surgery, medicine, internal medicine, general practice, psychiatry, pediatrics, obstetrics and gynecology, etc. And if you get through all those rotations, some of them are 12 weeks, some of them are 6 weeks long. So surgery and medicine are 12 weeks long. Each one of those comes with its own exam, because mark my words, folks, if you think your exams are tough at the moment, you will be doing exams for the rest of your life, okay? It's not like you finish medical school and you're done. You have to carry on doing exams. You have to carry on recertifying, revalidating all the time. So 7 core clinical rotations across MD year 3. MD year 4, you get some optionality. You have to do another 12 weeks of medicine and 12 weeks of surgery typically, but assuming you got through all your core rotations correctly and passed all your exams, you then can do some electives. Another fatal mistake to make at interview is when you're asked, what type of doctor do you want to be in the future? Again, a trick question. You don't know now what the practice of medicine is like. You may have a parent who's a doctor. Okay? You may have a friend who is going to medical school. You may have done some observerships. You may have shadowed somebody, but you don't know what the real practice of medicine is like, nor do you know where you want to be in the future. Okay? You may think you want to be in the US now. Mr. Patel, who's on the call, probably thought that he wanted to, maybe he wanted to be in the UK, maybe he wanted to be in the US, but SGU gave gave both Dr. Jackson, Mr. Patel, the opportunity to do clinical rotations in the UK, in the US, and to do a wide variation of clinical rotations with some optionality. So where it says MD year 4, that's when you can do some elective or sub-internship type modules, because at that point, you've gone through and witnessed and been part of a team. In MD year 3 and MD year 4, you will be effectively a functional member of the team, often the first person to see the patient after the nursing staff or triage staff. So that's the point that you should know where you want to be and what type of doctor that you want to be, okay? Not at this stage, not necessarily in MD year 1 or MD year 2, but certainly by the time you've finished up your core rotations and gone into MD year 4. I've got on the bottom line of this, and I don't have my pointer on, so forgive me. On the bottom line of this, I've got the graduate route for the UK. I've mentioned already that this is an opportunity, or this medical school gives you the opportunity to practice in country of origin after you graduate, to practice in the UK and the US, which is really remarkable. And to be able for us to do that, we have to enable you to be fit for your residency application in the US or foundation program here in the UK. And I'll leave my clinical colleagues to talk a little bit more about that. The other thing that I have to tell you about, or should mention, is if this is going to be difficult, okay, medical school, no one's going to tell you that medical school is easy, but what we do at St. George's is that we make sure that we support you across that journey. So you are here at the far left-hand side, whereby maybe you're making an inquiry, and with Benjamin's help or Britannia's help, we'll hopefully turn that inquiry into an application. You'll have an interview, and you need to make sure that you don't make those 2 fatal mistakes in the interview, especially if I'm interviewing you and I ask you, why do you want to be a doctor? You don't say because you want to save lives. You don't say you want to make a difference. And you also don't say that you want to be a neurosurgeon as an 18-year-old, okay? You then go through the application process. You can see the basic sciences, depending on whether you are, what stage you're applying at. And this is the point that another great thing about St. George's is that we look at your applications on a case-by-case basis. We have a rolling process of application as well. Unlike the UCAS UCAS deadlines here in the UK, whereby you can only apply to medical school but once a year, okay? We can take you in at any stage of the year. We have more than 1 intake a year, and actually, in fact, for our basic sciences in the 4-year program, we have 3 intakes across each year. And we can also look at your qualifications, wherever you've come from, on a case-by-case basis and match you up to whether it's that 6-year program, the 5-year program, or if you're a graduate, the 4-year program. The rest of this is just an evidence of all the bits and pieces that come into helping you make sure that you succeed. How do you succeed? Well, you need to do well in the external exams. USMLE I mentioned, the UK MLA I mentioned, okay? You need to also make sure that you are getting a broad clinical experience, okay? Which I have also mentioned across those MD year, the penultimate 2 years of your time with us. And beyond that, we need to be able to support you, okay? It's difficult, so there needs to be layers of student support. And we're getting much better at this, better than we've ever been at providing, whether it be pastoral care. We've got a dedicated Dean of Students office, okay? We've got a Department of Educational Services if you've got any issues with your approach to the material, because you do have to learn how to learn. The way that you've probably been learning at this point involves memorization for an exam, regurgitation, okay, in the exam, and then forgetting what you learned before. You need to be able to be lifelong learners. You need to learn this material and learn it for life. There's no point in approaching a patient and saying, sorry, I missed that lecture whereby I was meant to be learning about how to read an ECG, okay? And so on and so forth. So there's layers of support, okay? And there's layers of support. Predominantly the audience I'll be speaking to here are international. So we have a vibrant international office, okay, international student affairs office, and you'll be supported, obviously, regardless of where you come from. We're a big medical school. You've seen the hyperbole, you've read, seen the stuff that we put on the website. We are the biggest providers of doctors to the US healthcare system. The classes, in terms of intake, are big, but what we do is we make sure that it's that small group focus. So you're not lost across the colleagues that you're working with. I'm pretty much on time at the moment, so I'm going to, rather than go over time, see if there are any questions. I didn't see how many participants there were there. I will end my show. See if I can see anybody and take any questions that there may be.
Okay, thank you for that, Dr. Coe. It's really, really useful for those who are joining us both on Zoom and also on Facebook and YouTube, and we do have quite a good following, actually. There is one question, we've actually got 3 questions coming in. What I'll do is, if it's okay with everyone, I will read the questions out so people who are watching this presentation can at least hear the questions that are being asked, because they may have the same question themselves. Okay, they've got 3 questions here. Number 1 is an undergraduate baccalaureate required for admission, or are completion of A-levels sufficient to apply? Yes, A-levels are sufficient to apply if you're applying for the 5-year MD. The usual requirement would be to have 3 STEM subjects. The most common kind of group of 3 is biology, chemistry, and then maths. We do have some people have biology, chemistry, physics. We have had some applicants who've had 2 STEM subjects and 1 humanities subject who have been able to apply because they've been exceptional. But there are pathways for A-level candidates for the 5-year MD. For those who do have a degree, a bachelor's degree, then obviously there's the 4-year pathway, which Dr. Coe presented on his PowerPoint as well. So there are multiple points for entry. If that's okay, then is Bethana or Dr. Coe, have you got anything you want to add on to that particular answer?
Just nothing much, Ben, just to reiterate your the point that we look at each student on a case-by-case basis. So you can't just, it's not just your A-levels, you need to be a decent human being. You need to demonstrate that you've actually done something to investigate what the future practice of medicine's like. So done some shadowing, that's helpful. And then we will basically put you into whatever slot is most appropriate for you. Okay, so typically after A-levels, it would be that 5-year program. If you haven't done the right A-levels, it may be a 6-year program. If you have got a degree, as you said, Ben, we put you into the 4-year program.
Perfect, perfect. Someone said, what is the clearing process for UK undergraduate medicine? Now, the reason I know this is being asked, and this is to give context to everyone who's listening today, applications to UK medical schools this year have rocketed. There are over just under 5,000 extra applicants in the system. So one thing I can can't guarantee, but I can strongly suggest is that there will not be any seats for UK medical schools in clearing this year. There aren't usually that many seats available in clearing anyway, but with the change to A-level grading and marking this year and the lack of seats and the increasing number of applications, it's even less likely there will be seats available this year. We can take applications for the program for SGU at clearing, which is this year will be August the 10th and 11th. It's a bit earlier this year. And the one option that SGU gives us is they have an enrollment in January in addition to the other traditional enrollment in kind of August, September. Bethana, Dr. Coe, for those students who are getting A-level results this year, say on the 10th of August, is there still going to be the opportunity, provided they're in the UK, to still enroll at the Northumbria program this coming September?
Absolutely. The 5-year program, that's actually one of the advantages. I said they're exactly the same regardless of whether you're in Grenada or here in the UK, but the 5-year program actually starts later than Grenada. So we start on the 27th of September. Okay, so that means we can potentially take applicants depending on visas. Obviously, there's some stipulations that if you are coming into the country, we could take your application, but you'd have to make sure you get a visa. We potentially also have a little bit of leeway because of COVID for you to start online and then, come whenever you can get that visa, whenever you can get to the embassy or the British High Commission appropriate. But yes, so I'm, really, really flexible in that regard. And I just echo your point about clearing. There's a whole host of factors that have led to increased number of people applying for medical school, including COVID-19. Okay, more people want to be doctors. The NHS did a wonderful job in managing COVID-19. And when I was applying for medical school, there was something in the order of 15 to 20 applicants per place. It dropped subsequently for a while, but now we're looking at that that ballpark figure. There won't be any clearing places. There wasn't when I was at medical school, and I really severely doubt that there will be this time round. So the other part of this is that you can apply for SGU in parallel. You don't have to use one of your slots on your UCAS form. Okay, you're applying for a UK medical school, so you can do both. Nothing ventured, nothing gained. And maybe it get you. I don't mind if you come to join us. I think it's a good program. But if you get into medical school elsewhere, then the whole process of applying is something that's useful for you.
Yeah. Like one thing I want to say is obviously for next week, on Monday, Tuesday next week, the International Baccalaureate students get their results. So I think for those who don't get their seat next week, if they don't get that confirmed seat, we do have that opportunity to apply straight away for the program in SGU, both for the program at Northumbria, also directly for the program which starts in Grenada. So you can do those years in Grenada as well as Northumbria. And for those students who are currently in India, I don't know how many students from India are joining us at the moment. There's a huge situation in India with visas because of COVID-19 and the Delta variant. They can actually even start the program for the first year in Ramaiah colleges in India as well. So if we do have anyone from India joining us today who's thinking about applying and they're going to find it too difficult to get to Grenada or to the UK, they can even start that program in India themselves. What I would say is for those people who are thinking about applying to clearing, it's often good to get the application in just before, at least, so at least you're a few days ahead of the other applicants who might come in once they know their results, in terms of getting references together and getting a date in the diary for your interview. What I will do is I will explain to everyone, I'll even show everyone today how they can make the application to SGU through the Medical Doorway website, and it will take about 10 minutes for them to actually start that process. So hopefully we've dealt with clearing. For those people that are joining us don't know what clearing is, because it's a very UK terminology, it's basically when A-level results are published and everyone's trying to figure out where they can go to university if they don't have a seat at that point in time. Someone's asked a question, quite an easy one, and I can't actually answer this one. Can 17-year-olds apply for the medicine program at SGU? So is there an age limit in terms of starting on the first year of the 5-year MD?
No. Technically, and I can see where that question comes from. If you are technically a minor, some UK universities you can't apply to. We actually have a 7-year program whereby some students who've just finished GCSEs come into. It's not particularly pushed. But yeah. So that short answer to that question is yes, you can. Yes, we'll look at your application on a case-by-case basis. And one thing I didn't really go into that much is. Was reminded by Ben there, we've got 2 partner universities, one in Ramaiah, which is in Bangalore, and one here in Newcastle, which is Northumbria University. And the Northumbria program has been around for the past 13, 14 years, but we've got clinical sites, obviously, in the UK as well. And I didn't want to steal too much of the thunder of my clinical colleagues coming on now, but across 14 hospitals here in the UK and across almost 60 or 70 in the US, we have those core rotations and the further clinical rotations to be done. And you can mix and match. So on that slide that I was talking you through, you can do some clinical rotations here in the UK, you can do some in the US, you can do all your clinical rotations in the UK. And I think Dr. Jackson and Mr. Patel coming on have done a mixture of them. So they'll talk to that, but that's really where the learning occurs. The basic sciences that I'm referring to, the Ramaya Partnership and the Northumbria Partnership, are effectively a means of us delivering a curriculum with another university. Okay, so yeah, I mean, I really think that gives a lot of flexibility for you as the potential student or the student to and also gives you experience, so you can experience the universal healthcare system of the NHS, the payroll healthcare system in the US, and healthcare system in a developing world country like Grenada or India.
We've got a couple of questions on the chat box from Eugenia. I know you've raised your hand, Eugenia, so I'm not going to. I think you've asked the questions in written format, so I don't need to get you to speak. But first thing, is there any exchange programs during the school term? So does SGU have exchange agreements with other universities?
What we've got rotations. I mean, I guess you're talking about during the clinical years. We wouldn't routinely do exchange programs across the basic sciences. But for example, here in the UK, we would enable our basic science students to go to hospital, to get some early patient exposure. And in the final year, you have some optionality. So say you want to become an obstetrician in Basingstoke, or you want to become a pediatrician in Brooklyn, you could possibly do those clinical rotations, those optional clinical rotations in Basingstoke or in Brooklyn. And that's really where you start being a little bit smart, okay? Because if you choose, you know where you want to practice, okay? And you know what field you want to practice in, probably a good idea to do those elective rotations in the speciality in the hospital. Because if you're applying for a residency, okay, you're more likely to get into that residency through marking your own homework. The UK Foundation Programme is a little bit different. It's a centralized application process. So it doesn't work quite that way. I see a question, can you be licensed to practice in the USA?
I was going to say one out about the USA. It isn't St. George's, the statistics about going to work in the USA from St. George's are spectacular. I think the best in the world, actually. So I'm just going to hand over to you guys just to give the numbers, because they are truly spectacular for those who want to pursue a career in the US.
I'm not the salesperson, but I can speak to it. So there's, I think 1,190 matches into residency, and we are the biggest provider of doctors to the US healthcare system. In some parts of the US, SGU graduates constitute 2% of the doctor population. So in New York, for example. So chances are, I always think about, if I ever get sick in New York, am I ever going to encounter one of my former students?
Amazing. Yeah, that is correct, Ben. So we're actually the #1 provider into first year US residencies. So in 2020, we had 1,110 of our graduates obtain a US residency placement upon graduation. 2021, we have 1,067 and counting. And we've been the #1 provider into first year US residency placements for the last 11 years. So extremely proud of that. And as a percentage, that's 92% of our international cohort. So outstanding, really.
Definitely the leader. The next one is actually something I can easily deal with now. Someone's asked, just to clarify, I can apply on the day that IB results are released, right? No, you simply apply on the Medical Doorway website in exactly the same way you would do either before or after your IB results have been released. What I will do is I will share how to apply shortly on the Medical Doorway website. What I would suggest, if you are an IB candidate, and I can notice some of the names here who I know are IB candidates for this year, my recommendation is at least fill the form in now so we can start getting the application form built on the SGU database. Because if we do it next week, it's going to be extremely busy when IB results come out. You're going to need a few things to get the interview scheduled. You will need your motivation statement, and if you have applied through UCAS, you can use a UCAS motivation statement, slightly modified to make it specific to SGU. We need that. We will need a copy of your certificates, your results. So if you have done GCSEs or something else before IB, that. And then on IB results day, you can send us then your IB results. And as the rest of the form is already filled in, it just speeds the process up a little bit. The other thing we will need, which is important and can take a little while to get, is 2 recommendation letters from your school. For those who are in an IB school, one of those tends to be your higher education career counsellor, and another one will then usually be one of your teachers, predominantly someone from one of the STEM subjects who's taught you higher level biology or chemistry or physics. Usually it's going to be both of those. We would need them on headed paper, signed or stamped, scanned in an email, and we can get them directly from your tutors. They don't need to come from you. Your tutors can email myself. Some schools would not rather email me, they'd rather email the university directly, so they can email them directly to Bethana as well. Once we've got that, usually then you'll be allocated an interview, and based on the emails that I see, an interview usually takes place about a week after we've received your references. And then usually about a week after that, we would have your decision. Obviously at this particular stage, if we've got your IB results and they match the requirements, whether or not you do or need IELTS, then will also be indicative in the offer as well. Then you will then be made an offer of a place. At that stage, it will be unconditional. And adding into that, there was another statement from Eugenia about UCAT. UCAT is not required for any of the programs at SGU. So that kind of deals with that question fairly simply. You don't need to worry about UCAT. So for the moment, if you're an IB candidate, nervously going to be sitting over this weekend waiting for your results early next week, let's get the application in today. Let's get the personal statement built and in, and then we'll find out next week, once we've got your IB results, if we can then work towards getting that interview arranged.
Just one point of clarification there. I think somebody might think that they're at the wrong university at the moment. So we're not St. George's University of London, okay? And that's why there won't be any clearing for our program, but we've got direct entry. You know, you're speaking to the people who will be processing your applications personally. So.
Yeah, just remember, guys, this isn't St. George's University in London. There's actually quite a few St. George's universities actually around the world. It's quite a common name, thanks mainly to British imperial history. But yeah. But effectively, this is I think the Georgetown, St. George is the capital of Grenada. So the university is named after the capital of Grenada. Bethana's actually got a picture behind it is of the campus. That's not the campus in Northumbria because the sea is a bit bluer there than it is off the coast in the northeast of England. And the sea is also warmer than it is because remember, Northumbria, it's the Arctic Ocean when it goes around the corner. So, but either way, beachside location, regardless of where you choose to study. So we've got another 5 or 6 minutes before Dr. Cowie has to leave us, and then we can hand over to our esteemed graduates who can tell a lot more about their experience as a student and then as a practicing doctor. So if anyone has got any other questions, please type them in. What I'm going to then, while we wait for those questions to come in, Dr. Cowie, is it okay if I ask a couple of questions? Okay, yeah. So how do students who perhaps start the course in Northumbria, whether they be British or international students, what would you say your best advice is for them when they transition into that 3rd year of the 5-year MD or 2nd year of the 4-year MD, to transition from, say, the UK to Grenada?
Well, be ready for colder, so warmer sea on the other side. No, I mean, it's normally seamless. So if you finish your 1st year of the 4-year or 2nd year of the 5-year, 3rd year of the 6-year program, you come in January, you'll finish in December. Okay, so you'll have about a month to transition over to Grenada. If you come in August, you will basically finish in May, so you'll have a little bit longer to transition. We help you with shipping. So student life here actually at Northumbria campus is like being a Northumbria student. You actually carry both your SGU ID and your Northumbria ID. You stay in Northumbria halls of residence, but we put you with all the SGU students because you tend to have to work a bit harder than a typical 18-year-old who's studying not medicine. So yeah, it's very easy transition. It really is. We do everything we can to help you, bar flying you over. So yeah, it shouldn't be an issue.
Those that are thinking about how to fly to Grenada, there's actually direct flights from Gatwick, British Airways. They actually stop in St. Lucia at the moment and then hop on to Grenada. And the airport is extremely close to the SGU campus. In fact, you can just literally come out of the Grenada airport, and then within minutes you're at the SGU campus. The SGU campus itself in Grenada is quite impressive in that it's a when I see the videos, it reminds me a bit of Disney World, because there's little buses that take you around the campus, etc. as well, and everything is on one site. So it is like living, like a Caribbean experience in one centre for that year or more that you will be there if you choose to spend more than 1 year there. How many students do you have starting annually on the programme at Northumbria, Dr. Cowie?
It's much smaller than Grenada. So we have typically coming in August about 70 to 80, and in January probably about 30 to 40. So it's smaller. That's for the MD4 program. For the MD5, we only started Ramaya and NU MD5 programs. It was my harebrained scheme, but we only started those last year. So we had about 10 in Ramaya and about 20 in over here at NU. The progression rates, and that's something actually I'm going to segue into in my last minute or so. People often worry about attrition, and they think that some of the Caribbean schools have very high attrition rates. I can tell you categorically that's not the case. So of those 20 or so students in the MD5, 16 or 17 of them got through, and that's, that's about right, because you're 18 years old, you're going into effectively a pretty intense program, and those students who didn't get through have been given the opportunity to repeat free of charge. So that's another misconception, is that you have to repeat year after year after year. You typically have to finish your first 3 years of the 5-year program within a 4 or 5 year timeline. Okay, if it's a 4-year program, you have to finish your first 2 years within 3 years, and your second 2 years within 3 years. So that gives you an opportunity to strengthen yourself if you've been deficient in an area. The thing we don't want you to do is to progress when you're not ready to progress, because it's not going to be good for you. It's not going to be good for the patient moving forwards.
Wonderful, thank you. Right, Dr. Cowie, we've hit 11:45 now. Thank you for your time. I know you're extremely busy. Go and teach now and speak to other students across the world who are actually currently studying at SGU. So I want to thank you for the time this morning, your expertise, and I think we've had some really good questions as well. Just a quick note to anyone who's watching on Facebook or YouTube, you can also leave a question in the chat feature on those systems as well, and we will be able to see them and get those questions asked. In the next minute, we're going to hand over to Dr. Jackson, who is a relatively new graduate from SGU, who can tell us about her experience of studying at SGU and then coming to work in the NHS as a relatively new graduate. What I will say to people who are logged in, please do just feel free to type your questions into any of the fora that we're currently streaming on, because we will get them answered by the specialists really over the next 45 minutes that we've got left. But Dr. Jackson, I want to hand over to you now really, and just tell us a bit first, I think, introduce your pathway from how you entered the program to eventually how you ended up here, and what your kind of life story was over the last few years, if that's okay.
My apologies, there was a giant plane just flying over, so it's a little loud in the background. Hi, my name is Tatum. So where do I start? I graduated from SGU just recently, so this past January, but from the beginning, my pathway into medical school and finding St. George's University, I went to university at the University of Michigan. So I began in 2009. I did my bachelor's there in English literature and pre-medical sciences. I remained at Michigan for about 4 years post-bac doing medical research. I worked in vascular surgery as well as pediatric genetics research. So I did that for about three and a half years. I applied to St. George's University. I came across it really because one of my good friends from university was going to medical school in Central Michigan and was rotating during her clinical rotations with St. George's University students at the hospitals there in Detroit. And she recommended it to me, and she said, I think, I'm really impressed with what the St. George's clinical students are doing. US medical schools are incredibly competitive to get into. I had applied to a couple, but I threw a wider net and applied to St. George's University as my only other kind of international school to try and see if that was somewhere I'd like to go. I got an interview with St. George's, and the interview was actually with a surgical resident at one of the hospitals I had worked in Detroit. And so that was another kind of sign that I felt very comfortable. We had a great chat. We actually had a chat in his surgeon's lounge for about an hour. I did the essays, the interview, and I loved it. I signed up. He had a similar story to me, kind of doing a bachelor's, worked for a couple of years, found St. George's to be a really good fit for him and to launch himself into medicine, and I was the same. So I began my 4-year program January of 2017. I came to Newcastle. So I did the Northumbria program, which was previously called the KBT program. I was in Newcastle for a year. And then, as Dr. Coey just spoke about, went to Grenada for my second year of basic sciences. I took my USMLEs, and then I split my clinical years between the UK and the US. I had never really thought I would go to the UK in medical school or that I'd be interested in returning to the UK, but I loved my experience with the Northumbria University program so much that I did my OBGYN, pediatrics, and psychiatry rotations down in the Southampton area of the UK. I went back and did my internal medicine and family medicine rotations in the US, a little bit closer to home, so on the west coast of the country. I'm from Arizona. And then I preferred my training in the UK, so I went back. I did my surgical rotations as well as all of my 4th year electives. I graduated just this past January with honors, and then I have begun my applications into UK FPO this year. So you do have a bit of a gap year as an international graduate with the UK FPO applications, as they're just a 1-year cycle. And I kind of entered that cycle right before, I guess, it ended in January. It starts in August, or just now, actually, this month. So during that year that I have until I hopefully am placed into a junior or foundation training position, I am working as Dr. Coey mentioned, a clinical tutor, doing a clinical teaching fellowship for the MD5 program. I started teaching into their 2nd term, which is the more intense term of that program. And then at the same time, I'm completing my master's in public health. So I've been busy this past year after graduating. It's kind of been nonstop. In addition to examinations, I know Dr. Coey mentioned some of the exams you have to take constantly, not only in medical school. I did complete my USMLEs. I also have completed the first part of my PLAB and my Royal College of Surgery exams. So those are all being done during this year that you're kind of forced to take while you apply to UK FPO, but you can make it incredibly productive. So that's a bit of my story about what I did at SGU, how I came across SGU, and it's been a great experience. I've really kind of used a lot of the resources that the university can provide in traveling. I mean, I now live in the United Kingdom. I want to work here. I loved the NHS. I loved working in it. Found it to be somewhere that was really just beneficial. It's working in a socialized healthcare system coming from the US with the privatized healthcare system. I also found their clinical training and teaching to be absolutely superior. So I'm here. I'm very excited to be here to chat with you guys, answer any of your questions about the UK, the US, Grenada. I've done it all at this point.
I think that's one thing which comes across there. The SGU experience is unique in that it allows you to be in so many different places. In theory, you could even study in 4 places,
Yeah.
You're not, it's not one campus where you're seeing the same thing all the time. For those students that want that global experience, SGU is unparalleled with any medical school really that offers you the opportunity to do academic study in different locations, and as well as clinical study in the US and the UK, which are where, most students want to get at least some clinical experience. So one thing while we wait for some more questions to come in, your transition from, you know, living in it and experiencing the US and then studying in Grenada and then coming to the UK, to the hospitals here, which are very different than perhaps what your prior experience was. What did you find? How did you find that transition from perhaps an American style curriculum and experience to the NHS, which is, you know, one of the largest socialized healthcare systems in the world?
Sure. So I had worked in the American healthcare system through research, clinical research. So I was in the hospital quite a lot during my undergrad years, and then about 4 years post back. Coming to the UK, it is different. The hospitals are different. The NHS is, there's a lot more, how do you describe it? The training, there's similarities. I guess that's probably the easiest way to begin. There's a lot of similarities. So where you start in terms of intern years and then specialized training, and then get to where you want to be in terms of attending or a GP, so the names differ once you come over to the United Kingdom. You do have a junior doctor, those foundation training. So in the UK, you are a junior doctor for 2 years, possibly 1 year, depending on kind of what you do after graduating medical school. So that is different from the US, those 2 years of kind of basic internship training. I liked them. I liked that idea. I liked working with the junior doctors that I did in the UK. It gives you a little more time to practice different aspects of medicine with all the responsibility, but still the support and comfort of training that you're still learning the job. In the UK or the US, you specialize quite quickly. So you take your USMLEs and then you apply to residencies based on what specialty you'd like to go into. Sometimes it's not as specialized as you'd like to be. So obviously you can apply to internal medicine and then want to be an acute respiratory physician, or you want to be a cardiologist or things like that. So, but you do specialize faster. In the US, in the UK, I found those foundation years really formative. And for people, I mean, I've always had an interest in surgery. But I never came into medical school saying I'm going to be a surgeon. I really kept every option open, wanted to explore all the different specialties in medicine. And I think those foundation years give you a little more time to prepare yourself for what the actual day-to-day job is going to be like. What do you actually want to do for the next few decades of your life? And you do see higher burnout rates in the US because you do specialize quite quickly without necessarily knowing what are my responsibilities, what's my every Tuesday gonna look like. So I liked having those few years of still a little more choice, a little more getting the support, but getting your feet wet, learning the job. And so it was one of the reasons why I chose to stay in the United Kingdom.
Well, I say we've got 5 minutes more of Dr. Jackson's time. So while some questions come in, I'm just going to, if that's okay, just quickly show people how to make an application, because I know people have been on the line for about an hour now listening and want to see how they make an application, because I know there's some arts or international baccalaureate applicants who are keen on that. So while we just wait for some questions to come in, I'm just going to share my screen. So for those that are wanting to make an application to SGU, I hope you can all see my screen now. Okay, this is the Medical Doorway website, medicaldoorway.com. There's two ways to do it. You can either click on universities and go to St. George's University here. This is one way of doing it. And there's the university campus there. And then you will find a link to the application form right here. You can click on the application form and then just complete the form here. Very simple form to complete. Will take you about 5 minutes. Everything is all encrypted, so all your data is secure. Once you fill that form in, submit that, it comes through to us, and then I will check your eligibility, and then we'll reach out to you for the required paperwork that we need as well. Alternatively, when you come to the homepage, you can just click apply now, and you'll find the link to St. George's University there as well. So very simple. It'll take you 5 or 10 minutes to complete the application to SGU. If you're an IB candidate, my recommendation is do it before this weekend, because it means we can at least get on with many aspects of the application prior to your results coming out Monday, Tuesday next week. So everyone who's online, any questions at all for Dr. Jackson about her experience of transitioning to the UK or studying at St. George's University, please ask them now, because shortly we are going to move on to Dr. Patel, who has been working as a doctor in the UK for now 10 years. So a different kind of context, really. So anyone who's got any questions at all about graduating and then moving straight into foundation year that we haven't already spoke about with Dr. Jackson, please do ask those questions now, because people's time is valuable at this time of the year. Okay. Is there any kind of take-home messages, Dr. Jackson, that you'd perhaps give to those people who are listening in today, really, about your advice about why SGU is the best opportunity that you believe for you to take that first step to your career in medicine?
I mean, you said it is an opportunity for that first step into your career of medicine. So SGU offers you, I think, more options too. You can really take advantage of the many campuses. Although it's large, they do hone in on you as an individual. They do support you in what you do need if you need it. So people who are looking for this as an option, people who are excited about those opportunities to maybe travel to work in multiple health systems throughout the world, SGU is a great school to do that because it's unique. It's not something that you get necessarily in many US medical schools. I know the UK, you travel a bit more in medical school, but in the US, you definitely don't. So it was one of those aspects that I think you should take advantage of. If it's something that sounds interesting to you, if it sounds like something that will offer you that opportunity to start your career in medicine, absolutely apply and just see what happens.
Wonderful. Listen, thank you for your time. We will let you go now, get back to your busy schedule. And just to bring things home, really, before we summarize, I'm going to hand over to Dr. Patel, who's further down the career path now. I can tell a little bit more about his experience of studying at SGU and how that prepared him for a career, not just in the UK, but perhaps globally as well. Dr. Patel, over to you.
Hi, everyone. Apologies in advance for the building works that you might hear. There's some building works going on nearby. So I am a ST7 in pediatric surgery at Birmingham Children's Hospital. That means I'm almost finished with my training, and a consultancy is hopefully looming in the future. Just to give you some background for what I've done, as you can tell by the accent, I didn't grow up here. I was born in the UK, grew up in the States. I went to Emory University, and then I wasn't quite sure really what to do with my life. So I did some physics research, moved back to Britain, and then eventually decided to go to medical school. And at that point, again, I wasn't quite sure where I was going to stay long term. I had family and friends in the States, family and friends in the UK. So SGU was a nice opportunity for me to be able to tease that out. When I applied, I then started in January 2006, which feels like ages ago. I did 2 years in Grenada, and the 2 years in Grenada were both fun, but also very intense. So I'm sure there's been a bit of curriculum changes since then, but it was very much subject oriented. So you did anatomy, biochemistry, embryology, pathophysiology, and it was very intense, the material that you did learn. You then did have a break. So we would have exams sort of midterm, so halfway through the term, and then an exam at the end. And so you'd end up studying for one exam and then enjoy a couple of weeks of fun and freedom and go to nearby islands, have some fun, enjoy time with your friends, go to the beach, and then you do the same thing again before the end. And then you'd get a break for summer and then a break for winter. So it was fairly high paced, but it was also quite nice because the advantage to being in Grenada is there's not much else that can distract you. And to be fair, the people that are on this call, hopefully, are doing this because you really want to be in medicine. And it's nice to be in an environment where everyone there is dedicated to that. The university itself, over the years, has figured out how to do this better and better. And as Dr. Coey alluded to, there are resources to help you if you're struggling. They identify you earlier if you're struggling, and they find either peer tutors that can help you or slow the program down so that it's at your level. That is their goal. Their goal is to get you through. Their goal is not to sort of, take whatever they can and then off you go, which you may sometimes find in other universities. So it's really nice and really reassuring. The DES department that they have was a bunch of tutors. I did some tutoring work when I was at DES. And you, again, work with students together and just try and go through what common problems did you have? How did I find a way to figure this out? and what other things can go along. So it's really nice in that way. And similarly, it's then a nice excuse to go to a place that you've probably never been to, and then also visit nearby islands that you may never go to again. And that was really nice too. So we went to Venezuela once, we went to Margarita Island once, we went to St. Vincent and the Grenadines, and then I went to Barbados, Jamaica, and somewhere else that I've just blanked at the top of my head. So it's really a fantastic opportunity when you're in Grenada. And then the last bit of that is, as you're finishing in Grenada, you get to then do some clinical rotations there, not by yourself, supervised, just kind of touring the hospital and seeing how things are. But it's a great opportunity to see what healthcare is like in a third world nation, which unfortunately is what Grenada is. You will find that the pocket in Grenada that you are is first world. The campus itself is all very, tailored and catered to UK and US students. But as you go explore the island, and you should do, you find that it is a sort of impoverished country, and you'll see what third world medicine can be like. And similarly, the university and the students help out in that. We would do drives, we would do sort of, fundraisery type things, and we would go around and do health drives for them. So that's what we did when we were there. Once you're done with that, the next focus is very much on getting an exam done. And if you are someone who's either going to go to the States or thinking about going to the States, then you end up taking the USMLE Part 1. If you know that you're never going to go there, then there's a SGU version of the exam that you take that then doesn't prepare you. I would recommend taking the USMLE Part 1 regardless, because at least you've got both opportunities should you decide. And that normally is a couple months, and it's very helpful then to have gone through all of this background basic science work, because that's what you'll need, not just then, unfortunately, not just in the future, but for almost every exam you'll take, including the one that I took about a month ago. So it's really important to know how these things go, because it's never going to go away, unfortunately. And the university itself has a really high rate for the USMLE. In fact, the last time I looked, it's higher than what US students score on the USMLE. So they're very dedicated to trying getting you to pass this. Once you've done that part, then you do clinical rotations, and you have a choice of either doing them in the US or doing them in the UK. I did my first 7 months in the UK. Then I did my next year and a bit in the US. So in the UK, I was in Watford General, where I did general surgery and medicine. And then I did some orthopedic surgery at Stoke Mandeville. And then I went to the States, and I was at St. Joseph's. Mainly I went there because my friends were there. That's in New Jersey. And I did my psych, peds, and obs and gynae rotation. And then I did some pediatric surgery and neonatal intensive care at Morristown Memorial. And then I did some peds rotations at Miami Children's. And it was a nice experience of what it was like. And up until I went to the States, I wasn't quite sure where I wanted to practice. The American healthcare system didn't appeal to me, but that's something that only you'll know once you go there. And similarly, I have a ton of friends that work mainly in Texas at the moment, as doctors and physicians there. So it's nice to figure out what you want to do. And I think SGU gives you that opportunity. Once I finished, I still took my USMLE Part 2. Again, if you don't want to do that, there is a SGU version of that exam that you would take to finish. So you still need to take an exam. But I took my USMLEs and I finished that, and then I came back here. And at that stage, we had to take what's called PLAB. This is going to change, as Dr. Cowie had said, but it's an exam that all students who have not graduated from a UK medical school need to take to be able to practice here. So it's a bit of time that you take, and similarly, as they need to then have a bit of time to then apply for the foundation program, but that's okay. And then from a foundation point of view, there is a difference, and I'll briefly talk about the two differences because some people don't have an idea. So the foundation system here, and every subsequent job that you will have in the UK until you're a consultant, is very much an anonymized, non-discriminatory, non-biased, non-individualized approach. You put your details in, It plugs out what numbers you get. You might get numbers for doing a paper. You might get numbers for teaching a course, and it gives you a score. And then based on that score, you're then allocated to a program. There are things that you can do to improve that, and there are things that you can do to make it better. But it doesn't matter who you know at, I don't know, University College of London. You still all go through the same process, which is quite nice. And that is very much how the UK is based. So you would apply for that from a foundation point of view. That's the first 2 years that every doctor in the UK does. And it gives you a depth of both surgery, medicine, as well as emergency care, whether that's A&E or whether that's GP. And then after that, you can then choose your pathway. And I'll come back to that in a bit. For the States, you have what's called the residency, and you'll see this on TV and you'll have heard about this. But what that means is for most people, by the time you finish medical school, you kind of need to know exactly what you're going to do, as in the general pathway. And I think Tatum alluded to this too. So you need to know, I'm going to be a surgeon. I'm going to be a physician. I'm going to be a pediatrician. I'm going to be a family practitioner. And so you need to know that before you do it. And if you're not sure, it sometimes is a bit difficult to then restart things. Whereas the UK bit, if you're not sure, you've got a bit of time to make that decision. Either way, when you then apply in the States, you apply to individual hospitals and individual programs. And it very much is how you present yourself, how you know people, whether they like you, and whether things go well. So as Dr. Cowie alluded to, if you've then done rotations at, pick a hospital in the States, and you then want to then apply as a resident at that place, they'll know you. They'll know that you are a hard worker. They know that you were there. They know what things are like. They've spoken to colleagues that have worked with you. So it's really important to build that bond if that's a place that you want to then stay at. And then when you do interviews in the US, you then end up, I don't know if things have changed from COVID, but you end up visiting the hospital, you go on a tour of the department, you meet the residents, you meet the program directors, you meet the clinicians. They ask you some questions, but you also ask them. And it's very much finding which hospital, which department is the right fit, because you're going to be there for the next 3 to 5 years because they're investing in you for that period of time. So that's the big difference between the residency programs in each of the countries. You still learn the same amount of information, but very much in the States, it is tailored to whatever subspecialty or specialty that you're going to do. As a surgeon in the States, you probably won't be learning how to read an ECG or anything like that, or an EKG, but that's not your department to do. Whereas here, you will be. You'll learn a little bit of everything, and then you'll decide what to do. That's a choice that's up to you to make. Once you're done with residency in the States, then you often do a fellowship. The fellowship then puts you in a better position to get a nicer job. One of my friends didn't do that, and he's got a fantastic job in Atlanta, Georgia, and it doesn't matter, but it kind of depends on what you want to do. So if, for instance, you choose to do medicine, then you may do a respiratory fellowship, which is then 1 year to 2 years. And now you're a respiratory physician as well as a general physician. So that then takes you about 4 to 5 years after you finish medical school. And then you look for your attending job. Attending in the States is the same as consultant in the UK. In the UK, then you will have done 2 years of foundation program, like I said, that everyone does post medical school. So that's the first 2 years. After that, you then have a series of pathways. If you want to be a GP, you then have another 3 years that you need to do, one of which is in hospital, the other 2 of which are in GP practice before you're then done. So that's a 5-year program all told. If you then want to do any other subspecialty, as in medicine, surgery, etc., you do either a core training program, though that is filtering out because it's not really relevant, or you do what's called your registrar post. And that's what I've done. So I did core surgical training for 2 years, and that was a mix of so my foundation years, I did urology, cardiology, renal medicine, and then my second year I did GP, upper GI surgery, and trauma and orthopedics. These were all 4-month rotations. And then for my core training, I did 6 months of urology, 6 months of cardiothoracic surgery, and 1 year of pediatric surgery, because I knew that that's what I wanted at that stage. And then you apply for your quote unquote number. That's being a registrar. And there are a limited number of registrar positions each year. So you do apply, but again, it is sort of what points do you have? And you can do things to make your points better if you don't succeed, and that's okay. So I started that program in Glasgow in 2016. And that's then a 6-year program. So I will be scheduled to finish in August 2022. Obviously, with COVID, unfortunately, as a surgeon, it affects me probably the most because I need to be able to operate. And for the last year or so, I've not really operated as much as I've wanted to do. So I may end up lengthening that of my own choice because I kind of need that bit before I'm then comfortable at the end. But that's the basic plan, is once you're a registrar, it's a program for about 6 years. Certainly as a surgeon, it might be slightly different for some of the medical professionals. And then once you're done with that, you then apply individually to each program for wherever there's a consultant job at the time. And that's, again, similar to the US bit, where you go face-to-face, you see the department and the department sees you. So I hope I've given you a rough idea of what things are like. I hope I've given you an idea of how SGU helps in this matter. Some of the things for the UK students will be similar. Once you get into foundation program, it doesn't matter what university you went to. Nobody cares. Because like I said, it just depends on what you're like and what you've been doing. I have worked with graduates from Oxford and Cambridge, and I've worked with graduates from unknown hospitals, and they're all the same. It doesn't make a difference. But the key bit is the information that you gain and you gather, especially in the first 2 years of medical school, are going to be with you at least for the next 10 years and for every exam that you've taken. So it's really important. If there's anything you'd like to ask me, either now or later, please ask some questions. And if it's something you want to ask me personally, then please get in touch with Bethania and she'll pass the message on to me. Thank you.
Perfect. Thank you so much for that. It's really insightful. And to have someone who's gone through the process of being at SGU, going through the clinical placements, both US, UK, and then actually working in the UK for 10 years, really, it's testament to your expertise and what SGU has given you to allow you then to go on and take your career where you are. Just south of where I am, 45 minutes south of where I am in Staffordshire. So that's fantastic. So maybe we'll actually might meet each other at some point in the flesh rather than virtually when we can get back to doing that. So while we've still got Dr. Patel and Dr. Jackson on the line, I would recommend that anyone who's got any questions either on Zoom or on Facebook or on YouTube, where I can see people are signing in, please do ask them now, because time is finite and we are rapidly running out of the time. And this is your opportunity now to get the answers to those questions that you want from people that have gone through this, because no doubt over the next few weeks, people are going to be applying. So please do ask any questions that you have. While we're waiting for any questions to come in, I think it's just important to reiterate that, as we said at the beginning of the presentation, there is the opportunity to enroll towards the end of September at the campus in Northumbria, because that is going to be useful for those students who are coming through clearing either at the IB results or A-level results, or students who are delayed through COVID. One thing I will kind of touch on is how the university adapted to COVID. A lot of the tuition, especially theoretical tuition, did move online, and I've spoken to students earlier in the year from all over the world, from Zimbabwe and from Hong Kong, who have actually gone and studied the start of the program online and then are now transitioning to Grenada. A couple of other points. For those students who are going to Grenada to start the program or partway through the program, Grenada doesn't have the same kind of visa procedures that you would experience in the UK. Because it's an island in the Caribbean, you aren't really going anywhere unless you're going on a boat or swimming or flying. So there's no actual strict visa procedures. Once you arrive in Grenada, provided you've got your offer paperwork from the university, the immigration authorities there will grant you your stay once you arrive. For those that are coming to the UK, you will need to plan that a little bit more, because there are certain rules and regulations that the UK has in terms of getting a tier 4 student visa. So you will need to demonstrate that you have your unconditional offer. You will need your confirmation of acceptance of studies. You will need to apply for the visa in enough time, and the visas can take anywhere from 3 weeks upwards to actually get to come to the UK. And then once you're in the UK, there are certain rules and regulations that you need to abide by here. So it's just a question of being aware of those at the start and allowing yourself enough time to go through the process. And I think with COVID, allowing yourself even more time than you would usually do to make sure you've got everything in place before you actually formally make that visa application. At the moment, there's no more questions coming in. Bethana, is there anything else? Oh, hang on, we do have a question coming in. So what I'll do is I'll come back to Bethana in a moment, but let's deal with this question first. Someone said, could a student attending a USA university apply after completing 2 years? This assumes that the student would have completed requisite science and math courses in the first 2 years of the USA baccalaureate program. So this is someone who's thinking about doing perhaps 2 years of credits at a US program and then coming to apply to SGU. The one thing you wouldn't be able to do is apply for the 4-year program, because that would require you to have graduated from that program. But is there a pathway where a student could perhaps apply for, say, the 5-year program on the strength of their academic ability on the 2 years of the USA degree? Bethana, can I hand that one over to you?
Yeah, of course. Thanks a lot, Ben. And thank you, Dr. Jackson and Dr. Patel, really insightful. But as we said at the beginning of our session today, you know, when we are evaluating each and every applicant, we have a faculty committee who review each and every applicant, and all of our applicants are reviewed holistically. So it won't only come back to your academic background, but obviously that will be taken into account. So for example, if you have completed 2 years at a US university, what have you done prior to that? You know, have you, for example, completed an American high school? Have you taken advanced placement? Have you done A-levels? Have you done IB? All of that will be taken into account when we advise which program would best suit you. And in addition to that, obviously, we will be reviewing, you know, characteristics, you know, we'll be reviewing, you know, your personal statement, your letters of recommendations for a decision to be made as to whether or not you'll be granted interview. And then also we will review your performance during interview to make a final assessment as to which program would best suit you. Our major, obviously, programs that we do offer are a 4-year MD degree, a 5-year MD degree, a 6-year MD degree, and a 7-year MD degree. However, we do offer other programs as well that are really there to basically, you know, close any academic or English language gap that any of our students may face, as we recruit students globally from all around the world. So, for example, we have a Charter Foundation program, we have an English for Medicine pathway program. So I think the best thing to do is reach out to Ben. You know, he's one of our trusted partners. Reach out to Ben with the initial information that you have. He'll make an initial assessment and then pass all the details on to you for the committee to review and offer you their feedback. But, you know, it's definitely advisable for all of you guys who are considering a career in medicine and who've heard everything that SGU has to offer to you. Definitely, you know, submit your applications. We have rolling admissions. And, you know, as you heard in today's sessions, we have an August intake. However, for our SGU NU program, we have a later intake as late as the last week of September. So do reach out, and we look forward to hearing from each and every one of you.
Okay, right. There's another question, but I just want to add something in there. One thing I do get asked, and this is not just specific to SGU, but I have had it from applicants this year, is do I tell the university that I've studied this or studied that or studied the other, or shall I not tell them? You always have to tell everything. Okay?
Exactly.
Transparent you are, even if you've had an educational experience which wasn't very positive, that is not necessarily a negative thing, because if there's a reason it was not a positive experience, or you've learned from that experience, that is valuable information, because that demonstrates reflective practice, which is essential in medical practice. So the best thing is if you're fully open and transparent with everything in your academic background, then that allows the academic panel to make the right judgment for your success, as well as supporting you, not just in the application, but in your studies as well. And I'll even get questions about, I've been diagnosed with dyslexia or dyscalculia. I think that will be a disadvantage if I tell them. No, it won't be, because the university have systems in place to help support you if you have specific learning needs. There are actually countless doctors that do have dyslexia out there, because by the very nature of it, people who have dyslexia can be more practically orientated, and it doesn't reflect on your intelligence. It simply reflects on how you process information. And in fact, you will find that practically you may be exceptional compared to perhaps people that have had a different educational pathway that doesn't involve dyslexia. So please do make sure you're fully transparent with everything, because not only that way can we actually make sure that we're going to have the best outcome for you as an applicant and as a medical student. Someone says, is there a possibility of a scholarship for the complete degree? There are various scholarships available. Most of the international students that we deal with apply for something called the International Peace Bursary, which is one that's come across this year, where you would, once you've been accepted, you would fill that document in, a confidential financial declaration, and that's then assessed by the university, and you'll receive on letter a formal offer of a scholarship. We do get asked about students if they get a, what we call, which is commonly called in the US system, a free ride. We've not come across any students getting them. I think the university has provided some in the past in very exceptional circumstances as part of its giving back, but you will find that the vast majority of students this year who've applied for scholarships have been awarded anything from $50,000 to $90,000 scholarships, which is effectively discounted from across the duration of the degree program. Is there anything else that you want to add to that, Bethana?
No, that's very much well said. Thanks a lot, Ben. But yeah, obviously, you know, there are a number of different scholarships that are available to students. You can definitely go on our websites and read about them in depth if you'd like. Just generally, scholarships, when being awarded, are awarded basically based on academic merit. They're awarded based on volunteering history and work experience. And then we also take into account financial need through the confidential financial statement that Ben had stated. But yes, that is correct. The vast majority of our international students would be awarded, if awarded a scholarship, would be awarded the scholarship through our International Peace Bursary. Okay.
Wonderful. So there are, and some of the scholarship decisions we've had this year have been extremely generous, actually. We've had, I think based on the letters I've had about $250,000 worth of scholarships awarded this year to the applicants that we've had go to SGU. As I said, some awarded $50,000, some awarded up to $90,000, which is really remarkable generosity by the university, considering how expensive it is to run these medical programs, which give you those pathways into jobs in the UK and the US. I think that's what you're making a big investment in your future. And it's not a question of looking at what you're paying and thinking, is it cheap or expensive? It's what value does it give you? And SGU gives you that opportunity to study in the UK, the US, for clinical placements across the whole of the US. For those that do think about working in California, which has got one of the best developed health economies in the US and some amazing hospitals, both there, Massachusetts and New York, are kind of the centers of those clinical excellence in the US. SGU gives you that opportunity to actually work in hospitals in those regions. So someone's asked, an Ethiopian student who goes through the SGU program could practice in the USA with no problem. Any visa considerations here? Well, as a student, you will have the same rights to go there on your clinical placements as an SGU as any nationality. You're not from, Ethiopia is not one of the countries which the US puts restrictions on in terms of student visas to go and work in the US. The way that you would then work in the US after graduation is based on residency matching. So your USMLE scores, when they are scored, one of the steps is moving to a pass-fail, so that won't count as much. But you will go through the residency matching system. You won't be first in the list for that. First in the list is obviously US citizens trained in the US and then US citizens trained overseas. But international medical graduates do make up a significant portion of those people who go into residency in the US. And of all of the actual universities around the world, SGU is by far and away the number one if you want to do that. So if you are determined to actually work in the US and you're from Ethiopia and have an Ethiopian passport and want the best opportunity to get a residency placement in the US, the data says quite clearly that SGU is the number one opportunity for you. And again, if you demonstrate your willingness to actually commit yourself and from a financial perspective, you need assistance, there are scholarship opportunities there to help you reduce the financial burden of studying the medical program at SGU.
I'll just add on that to say that SGU will provide you the opportunity to be able to do a residency in the States, but getting a residency in the States, if you're not a US national, is implicit on either getting a temporary visa to work there just for the residency bit, or a permanent visa to work there as a resident and continue to live there. And that unfortunately has nothing to do with the university and very much has to do with whichever program you apply to at that stage.
What SGU will do is support you fully through the residency matching system, because the system itself is very prescriptive on the steps that you need to take at various points in the dates. So, you have to have had step 1 of USMLE, step 2 clinical knowledge, step 2 clinical skills, which at the state currently you have to sit in the USA for that step of the exam. And then your ECFMG approval of having your degree approved, and then entering the residency matching system, and then choosing about where you would choose to do your residency, and then trying for those hospitals to actually match with you. But I can give you basic advice on that just from my knowledge, but SGU live and breathe it on a daily basis, and they'll be able to provide that expertise and that assistance with far more competence perhaps than I can here in my office in the UK.
Yeah, thank you for that, Ben. I just wanted to add to that, when you do join SGU, you are, you're part of the community. So you have, the Department of Educational Services, you have the Office of Career Guidance, and many more international offices that are there to support you. So you will actually be connected to advisors who will actually set into motion an individualized and personalized residency placement strategy that is specific to you, to ensure that you have the best chance of obtaining a residency as you can. As we said, we're the #1 provider into US residency placement rates, and as a percentage, 92% of our international cohorts, were able to obtain a residency placement, for example, last year. So it's really important to take the data into consideration, but obviously, at the end of the day, nothing is 100% guaranteed, but the success without a doubt is there, and it is consistent. It's been there for years, and it continues, and it is growing. So thank you.
Right, I think we've come to nearly 12:30 now. The time has absolutely flown by. That's 90 minutes we've been online for now. So I think other people are having to disappear now because depending on where you are in the world, it might be early or very late, or as we are in the UK and Europe, it's lunchtime, and being of Italian origin, lunch is important to me. As Bethana knows. So what we will do is we're going to say bye to everyone. What I would suggest is if you do have any questions that perhaps come into your mind after this, just email us hello@medicaldoorway.com, or alternatively fill in the inquiry form on the Medical Doorway website. If you want an individual consultation, you can again book that on the Medical Doorway website. You simply fill in your section of the website, and it will automatically generate a diary entry for us and a Zoom link, and then we can have conversations directly with you, or we can set you up with one of our colleagues at SGU as well. Someone has just said, thank you, informative and well presented. Thank you very much for that comment. It's always great to have feedback. And what I'm going to do now is I'm going to say thank you to Dr. Patel, thank you to Dr. Jackson, thank you to Dr. Cowie in his absence now, he's had to go elsewhere. Thank you to Bethana for coordinating all this and supporting our work to help students who are currently students who want to be doctors come to SGU to study and then eventually practice medicine. I want to say thank you for everyone who's turned in today, both on Zoom, YouTube and Facebook, which I've been looking at these 4 different screens I've got actually on the go at the moment. Thank you very much. Have a great day. Stay safe. And hopefully we'll see some of you later on this year, either in Northumbria or in Grenada. Take care. Have a good day.
Thank you, everyone. Thank you.